Hello, I'm Dr. Simon Bishop and I'm Programme Lead for the BA in Health and Social Care.
Hi, my name's Emma Tygestill and I completed the degree in Health and Social Care in 2013.
My name is Sandra and I'm originally from Ghana. I'm in my final year of Bangor University studying a degree called BA Honours Health and Social Care.
I came back to education as a mature student and I found the transition really easy actually, because I think that the admin staff and the lecturing staff were able to support me and understand the difficulties of going into a new institution, but also the commitments that I had within my family.
I decided to study this degree to explore a range of health and social care settings. There are lots of modules to choose from, such as mental health and society, sociology of health, and social work perspectives. These modules are interesting and explore the different aspects of health. The course helps you to develop the values, the knowledge, and practical skills related to health.
I chose to do the health and social care degree because I wanted to enhance my career prospects. I had a career in mind that I wanted, and the way to get that was to do the health and social care degree. All of the modules were really interesting, but they were also really diverse as well. So I think that because they were engaging, it helps you to be interested in the course. I found that lecturing staff were really helpful, but also their experience. So some of the lecturers were had previous careers as social workers and so on, and they were able to use some practical experience to really enhance and solidify the knowledge that we were learning in our lectures and seminars. One of the things that I did like was that in our seminars, the lecturers would choose current affairs or recent news stories, and then we would then as a class then discuss them, and I think that this helped to really hone in on what we was to be learning, but also to help us understand in a much more deeper and richer way.
The course offers a highly diverse curriculum looking at both health and sociological issues, both nationally and internationally. We have a really friendly and very experienced teaching team and hold a Gold Award for the Teaching Excellence Framework. We try to put you, the student, at the heart of everything that we do. The BA Health and Social Care programme runs over 3 years and is a combination of both compulsory and option modules. Each of the modules and each of the years builds on the ones that go before it incrementally, helping you to become a highly skilled and really employable health and social care professional.
I decided to study at Bangor University because of the excellent teaching methods, the beautiful environment, and also it's rated gold and has a high rate of student satisfaction. I like Bangor because of its beautiful coastline, it's a lovely place to study and live, and also it has a vibrant location.
But why wouldn't you want to study in Bangor? The scenery is just absolutely breathtaking. There's so much to do. There's so many places that you can visit. You can be on the mountain 1 minute and then you can be on the beach the next. So I think that although it was my local university, it's actually one of the best places to study in terms of being able to get outdoors, loads of things to do.
Bangor University is a really diverse place to study. We're bilingual and we actively support both English and Welsh speaking learners.
After completing the health and social care degree, I was able to gain meaningful employment in the sector that I wanted to, and having this qualification really helped me do that. I've since gone and left that career, and now I'm a postgraduate student studying a PhD in health economics and education. I think that the health and social care degree has really guided my thirst for knowledge, and it set me on the path to becoming a researcher, which hopefully I will be after completing my PhD.